Hi, everyone. Welcome to the YMCA Education Series. Today we have a topic, Parkinson's disease, the essentials. Today we have Dr. Nicole Reidy with us. Nicola is a licensed clinical social worker. She's with the University of Chicago Medicine in the neurology department with the movement-related disorders clinic. And so today we'll be learning all about the motor and non-motor symptoms, risk factors, treatments, and more. And on behalf of the YMCA, we thank you for your time and your expertise, and I'll let you take it away from here.
Thank you so much. Thank you guys for having me today and being able to present on such an important topic. Let me just get everything set up. Okay. So, yeah, I work with the University of Chicago Movement Disorders program with Parkinson's disease, but I'm also under the American Parkinson's Disease Association as well too. So I lead a variety of their support groups, advocacy, fundraisers, different things like that. So I assist with both. So we're going to start off with just a basic understanding of Parkinson's disease and how it can affect the individual and then the care partner as well too. So with the American Parkinson's Disease Association, we have a strong belief in optimism and hope. And with the diagnoses, what can we do to enhance quality of life and well-being? And how can we work towards research in terms of hopefully one day finding a cure for Parkinson's disease? So there has been a variety of research and understanding and knowing what Parkinson's disease is, the symptoms such as tremors, what are things that can help it, such as medication or any kind of therapy. And although somebody is diagnosed with Parkinson's disease and it is a diagnosis, everybody that has it is experiencing it differently. Some people may have more difficulty with tremors, some people may have more difficulty with gait. So what we always say is one person diagnosed with Parkinson's disease is one individual diagnosed with Parkinson's disease. And it's important not to necessarily compare ourselves to one another because everybody has different and unique symptoms and how they're expressing those symptoms. Also, Parkinson's disease not only affects the individual with the diagnoses, but also impacts their family, social networks, and community. So later on in the diagnoses, this may be someone in particular with their care partner, whether it's a spouse or a child or a neighbor or anything like that. And it can impact different relationships, such as friendships, mobility, and different things like that. The hospitals and healthcare system as a whole must be familiar with different signs and symptoms, treatments, and how it impacts the individual holistically. And it requires a team approach. So not only the neurologist, but the PCP, maybe the social worker, the nurse, the therapist. It's a holistic response to the diagnoses. So what is Parkinson's disease? Parkinson's disease is a disorder of the nervous system that can affect a person's ability to perform common and daily activities. So, most frequently, this can be walking, this can be shaking, this can be tremors or difficulty maybe with using hands. So there's motor symptoms, problems with moving, but there's also a lot of non-motor symptoms such as sleep problems or constipation, anxiety, and depression, which we're going to be talking about later. And, although there are those physical symptoms, there are also a lot of non-motor symptoms that can be impacted as well too, that maybe aren't as visible, but can be just as difficult to deal with. And the motor symptoms as a whole are due to the lack of dopamine. So essentially, what can help an individual to stay positive or happy. So it is very common within the diagnoses for individuals to experience an increase in depression or sadness as well too, since the dopamine is decreased. Parkinson's disease was discovered by James Parkinson's when he started to research it about different shaking in individuals that he was seeing in 1817. So here are the four main symptoms, physical symptoms, that you will see if there is Parkinson's disease. So any kind of a tremor. So this could be kind of shaking. We can either like see this in our hand. Sometimes we'll see it in our leg, in our legs. There can even be like neck tremors as well too. But difficulties kind of just keeping the hands or feet relaxed and in one place. So kind of a lot of shaking. Rigidity also means any kind of stiffness. So this could be stiffness in the legs, in the arms, having difficulty walking around, and may even increase in abilities like an individual's ability to walk around, do things throughout the day, such as take care of themselves, bathe, get dressed. Then there's also bradykinesia, and this is slowness. So with the rigidity and with the bradykinesia, the individual may take longer to do things. So specifically, this can be seen in a lot of walking, similar to activities of daily living. And then the last one is postural instability, so problems with balance. So you may see individuals have difficulty with their gait, with standing, with walking. It may be common to see an individual with a walker or a cane, or even later on, even a wheelchair as well too. So now that we know the more physical symptoms of Parkinson's disease, we're going to go into the non-motor symptoms of Parkinson's disease. So I'm sure a lot of people here are kind of familiar with this iceberg. Essentially, the tip of the iceberg at the top over the water, that's what we see. Those are the physical symptoms that maybe can be diagnosed or have a neurologist look at. But there are a variety of non-motor symptoms that individuals can experience as well too. And keep in mind, as we said, one individual diagnosed with Parkinson's is one individual diagnosed. So just because maybe somebody experiences depression doesn't mean everybody will. Or if somebody has a loss of smell, that could be just for some people. Some people may experience no non-motor symptoms, or maybe they haven't just experienced it yet. So we're going to start off with the neuropsychiatric. So I briefly touched upon this before, but with the lack and the decrease of dopamine as a whole, there is an increase in potential depression. So people may have decreased ability to find the motivation throughout the day to kind of get up and maybe stay active or do things that they enjoy. There can be anxiety about, what does this look like for me? Who's going to take care of me? How can I get the help that I need? And what does this look like in the future? So kind of like an ambiguous loss, not necessarily knowing what's going to happen and how can we cope with that uncertainty. There's different sleeping disorders as well too. One that I would say is maybe more common is when people are sleeping. Individuals with Parkinson's can at times actually act out their dreams. So, if there is a spouse in the bed, they'll see the individual maybe sometimes like it looks like they're fighting or they're moving around a lot. And sometimes this can cause individuals to have to get different beds or sleep in different places. And that's just, one of the sleep disorders that's common. There could also be cognitive impairment and dementia. And keep in mind, this is not everybody, but it does and it can occur. So typically, it is later on in the diagnosis, there may be like a mild cognitive impairment, which is minor, maybe memory concerns. But there can also be dementia as well too, and this would have to be diagnosed. And then the final one is apathy. So when I think of apathy with different patients that we've had, there's a lack of energy, maybe a lack of happiness, but you can clearly see it in the individual's face. So when somebody's experiencing apathy, it's kind of more, somebody maybe looks a little more stern or a little more focused and kind of just like a lack of desire to do things, not really having that maybe emotional optimism and things like that. So those are some of the cognitive concerns and mental health concerns that can also be correlated to Parkinson's disease. And then there's also sensory, so visual disturbances. This is actually something that, we're interested in, and I lead a variety of different support groups, and we've seen an increased need in assistance for visual disturbances with Parkinson's. We had a neuro-ophthalmologist present a few months ago and talked about different things that can happen with Parkinson's, how it can affect our eyes, our eyesight, double vision, different things like that. Um, and then there's also can be a loss of smell or different pain in the joints as well too. And then also different autonomics, so hypotension. Um, Another one that's really common as well too is constipation. And this is something that individuals may have difficulty or may not necessarily feel as comfortable to bring up, but this is, what I would consider to be a very, very common symptom in Parkinson's is constipation. And it's good to be open about it and bring it up to your doctors or your neurologist because this can be correlated with Parkinson's. And then also urinary dysfunction and sexual dysfunction or concerns as well too. So those are all different non-motor symptoms that can occur in addition to the diagnoses as well. So we're going to go over just a few statistics. So with Parkinson's disease, there's in the US, there's about 1 million cases per year and 60,000 new cases diagnosed each year. And someone is diagnosed every 9 minutes with Parkinson's disease. The average onset is about 60 years old. However, there is also young onset Parkinson's disease. And what that means is anybody typically under 60 or under the age of 55 or 50, that would be early onset or young onset Parkinson's disease. And that's about 10% of the cases. And with the young onset Parkinson's disease, there can be as young as an individual who's 32 years old who's experiencing this. We have different videos and education from the American Parkinson's Disease Association of what it looks like for somebody who's younger onset and different support and help in ways that they're finding to empower themselves throughout this diagnosis. And then finally, men are 50% more likely to get Parkinson's disease than women. And there's different risk factors as well too. So for the economic burden, there's about $52 billion each year spent in different things for Parkinson's. So that can be, um, you know, different like medications, caregivers, research, $25 billion for the US government, and 26 billion people with Parkinson's disease. So out of pocket expenses. So lost wages, caregivers, having to pay for certain medications, walkers, things around the house like OT or PT or something to help make your life a little easier. Or even that could be different, like I said, different care, or even like long-term long-term or assisted living care. So we mentioned this just briefly before, but there are different risk factors for Parkinson's as a whole. So as we mentioned, men are 50% more likely to be diagnosed with Parkinson's disease. So being a male is an increased risk factor. There's different environmental factors as well too. So we see people and we get phone calls from individuals who either served our country or people who live in rural areas. We have, a veteran's handbook on, how Agent Orange could have impacted this, or, we have different farmers who sometimes will reach out as well too, who have questions about different items that they've used, whether that's for weeds or grain or anything like that, and how that could have impacted their diagnoses. Genetics as well too. So some people can choose to get genetic testing if they would prefer, and if this is something that they want to pursue and feel more comfortable with. However, there's less of a lot of people may assume that it is genetics, and from what I've heard, only about maybe 10 to 15% of diagnoses are actually from genetics. So what that means is that of whatever the diagnosis is, um, can be influenced by a variety of other factors related to um, outside forces. And just because maybe a parent or a grandparent or somebody like that does have Parkinson's disease, it doesn't necessarily mean that you will as well, but that could be something to pursue. And then age. So, as we mentioned, typically individuals 60 and above are those who have a greater risk of getting diagnosed with Parkinson's disease. So, in terms of the genetics, there's been more than 20 genes that have been identified as contributing to Parkinson's disease risk. And like I said, most people with Parkinson's don't have that mutation in any of the identified genes, and many more genes may contribute to Parkinson's, but have yet to be discovered. And there's always different research that's being done and completed. Um, Having a first degree relative with Parkinson's only modestly increases a person's risk of developing Parkinson's disease. So it's important just to keep those in mind, that it's not always genetic and can be, but there is a, a slim possibility. For the environmental factors, different toxins such as pesticides and solvents can increase traumatic brain injury, and different environmental factors, like I said, such as veterans or people living on farms or areas like that. So now we're going to talk about different treatments. And as we mentioned, there is no cure just yet for Parkinson's disease. But what can we do to treat the symptoms? What can we do to enhance our quality of life? And what can we do to make our life easier to deal with the diagnoses? So medications. Some of the main medications that are known are carbidopa and levodopa, and the medications can relieve or decrease symptoms. However, something that I like to keep in mind and inform patients of as a whole is that, patients may get frustrated or upset, or find it difficult that, okay, maybe these medications aren't working right away. It is very normal and common to find kind of the right adjustment or the right potion or the right amount of each medication that needs to be taken before you are feeling better. So it does take time, and it is something to be patient for, but medications can help to relieve or decrease any of the symptoms. There aren't any medications to protect the neurons from degenerating. And as mentioned, the goal is to get the right dose of the tolerance of medication. Ongoing adjustment of the medication is key to effective treatment. So, maybe what works this year and what is kind of the kind of like the Goldilocks potion may not necessarily be what's going to work next year. And so it's good to keep in mind that as the diagnosis progresses, there's going to be different things that may have to change with the medications, and it may be that kind of trial area again. And the responses to the medications vary from person to person. So, in a variety of our support groups, individuals will say, "Oh, well, what medication are you taking and what are you taking?" And this is the perfect example of one person diagnosed with Parkinson's is one individual diagnosed with Parkinson's. Um, Everybody responds different due to their own body and their response and their diagnoses and their genetics. So it's important not to necessarily compare that. But just keep in mind that this is what's working for my body and what is your neurologist, nobody else's, but what is your neurologist suggesting for you? And people can take a combination of different medications, um, because each medication has different side effects. So that's why I also encourage to reach out to your neurologist or your gerontologist or your primary care physician to see if there's any contraindications of any of the medications and what can be done so you have the least amount of side effects as possible. Medication schedule is also very, very, very important. So with Parkinson's disease, individuals have to take the medication as prescribed, whether that's sometimes it can be 3 times a day, sometimes it could be 6 times a day. It just depends. But even if a medication is taken off schedule, or even if one medication is forgotten about throughout the day, it can definitely and severely impact an individual's symptoms, such as the tremors. So whether that's having an alert on an iPhone or, a timer, it's really important because taking the medications as prescribed will help you to, live your day in a more better and an active way. Um, People with Parkinson's can be advised to keep a diary to follow any symptom side effects and food interactions. Um, Different neurologists suggest when to eat protein following or prior to the medications. And if anybody has any questions as well too, you can always download the American Parkinson's Disease Association free symptom tracker app. And this is a place where you can download and share what are the different medications that you're taking, what are different side effects. You can get family members or neurologists on this as well too, and bring this to your appointment. So it's really an easy way to keep track of everything. And sometimes the app can even let you know, okay, well, this is when you're about to need to pick up another prescription of this medication. So it's really a good way to keep everything in one spot, and you can add family members to it as well too, so they can see how you're doing or if something's been missed. In terms of different rehabilitation therapies, there's physical therapy, so improving balance, walking, and strength. And there's speech therapy. A lot of individuals will have difficulties speaking and communicating with the Parkinson's disease. So, in the different support groups that I've led, some people say, I'm actually choosing not to go to this family event, or I'm choosing not to be a part of this just because I feel like people can't hear me, or they get annoyed of me, or I feel like I can't communicate with them and it's embarrassing. Swallowing concerns as well too. The speech therapy is called Lee Silverman voice treatment. And then occupational therapy as well. So improving any fine motor skills and independent living. And if somebody is having difficulty maybe getting in and out of bed, having difficulty walking, physical therapy and occupational therapy can help. And then the LSVT, they also have a program called BIG, and that is like their physical therapy. So not only do they help with voice and communication, but they have physical therapy specifically for movement for Parkinson's disease. So I'm gonna share my screen so everybody here can see one of the, let me pull it up, the video for um, LSVT loud, just so you have an idea of what this looks like. Let's see. Okay. Can you let me know if you guys can hear this? If not, I'll have to redo it. But let me know if you can hear this.
Your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can. You say Parkinson's disease has caused you to talk less
Yes,
because
because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. So I get mad and yell.
take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Son of the Southern Pioneers one of these days with my
Good for you. That's excellent. What practicing do you do at home?
my ahs, my eyes, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yeah.
Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "Well, I can hear you."
Good for you.
But I think he does that just to be cute.
I think he does too.
Okay, so that's a video to, I know it is, the voice was a little muddled. It is an older video, so I think maybe it partially has to do with that. But you can see just like, you can see physically, you can see emotionally how different she is and how much you can hear her. So that's just from the speech and the voice therapy. And like I said, LSVT, they also do a big program, which is for movement. And even if you were to Google or look up LSVT loud or LSVT big, it's really an easy website. You just put in your zip code if you're looking for the speech therapy or the physical therapy, and you can find who's closest to you. So it's a really accessible program. Okay. Give me one moment. My thing wasn't working. Okay. And then another option is also deep brain stimulation. So this is typically an option for individuals with Parkinson's disease who have taken the medication, have taken maybe the highest dosage as frequently as possible, and the symptoms simply maybe aren't getting better or they're not being able to be treated by the medication. So this typically can happen um, middle or later on in the diagnoses. And deep brain stimulation is a neurological procedure where electrodes are placed deep within the brain to deliver impulses to the different brain structures to improve Parkinson's symptoms. And the electrodes are connected to an implantable pulse generator in the chest, which can be programmed remotely. Um, there are different individuals that, do have concerns or worries about this, but I think that it would be great to reach out to your neurologist because, as a whole, even our neurologist and neurosurgeon as well too share that, it maybe isn't as scary or as frightening as it may seem. And we even have a video of an individual, and you can control, there's a control for it. So you can control maybe when it's on, when it's off, the intensity of it. So there's an individual, and they turn the device off, and then you see the individual's hands start to tremor, and then you see it turn on, and it stops, and then they turn it off, tremor, and then on. So it shows how just with this device you can actually live more comfortably and experience a decrease in the symptoms as well too. So outside of different therapies, we're going to talk about ways that we can manage well. What can we do? What are items that are within our control that can actually help our diagnoses and wellness? Exercise is a huge, huge, huge part of Parkinson's disease. Exercise as a whole is something that's really important, but exercise for Parkinson's disease, it really does help the mobility, the stiffness, um, anything like that. A lot of people, we recommend exercise, so it it can help to manage the symptoms and increase quality of life depending how often you're doing it. Being sedentary and maybe not necessarily doing anything or just kind of sitting can increase the stiffness, stoop posture, and poor endurance. So people always ask, how much should I exercise, how many minutes, and different things like that. So the Center for Disease Control recommends about 150 minutes of moderate intensity or 75 minutes of vigorous intensity of exercise per week for all older adults. Something that I thought was really interesting is we have our, um, physical therapist present, and she's told us a variety of times that, if, and it depends per individual, right? But if you're doing something that is maybe, just walking or anything that isn't necessarily getting your heart beat up, anything that's technically normal, that wouldn't be considered an exercise or a part of that 150 minutes. So, I used to be able to walk to work, and I'd walk at least over a mile and a half to 2 miles a day just on that walk. And that wouldn't necessarily count for me because it's not anything that I'm doing to kind of get my heart going. So maybe that would be jogging or going on a bicycle or something like that. But it has to be something where you're getting your heart beat up. But if for somebody, if that is walking, then that would work for you. And there's different kinds of regular exercise, so aerobic, strengthening, um, different stretching, and different things that you can do. Some people also enjoy swimming. Some people enjoy walks outside, maybe now that it's like a little cooler, or there's like an elliptical you can do inside. There's a lot of Parkinson's disease programming and exercise classes at different YMCA's. Aqua is pretty common right now, so there's different ways to incorporate that. People also ask about dietary considerations. What can I do to help myself to eat better and also maybe eat something that's good for my brain as well? So, different protein can compete with the levodopa to the small intestine, making medication doses less effective. So it is important that you're reaching out to your neurologist or nutrition regarding this. And as we shared, constipation is very common. So if you're experiencing that, it's important, to hopefully not keep it in, but be open to maybe your partner, a loved one, or your neurologist about it because they can suggest different things. Low blood pressure can be treated with fluids and some salt. And with Parkinson's, there can be increased weight loss. So it can complicate Parkinson's disease, but also be a sign of other medical conditions. So one of the main things that one of the neurologists suggests is, we listed all of those non-motor symptoms, depression, constipation, maybe urinary incontinence, or different anxiety and stuff like that. Just because you are experiencing one of those symptoms, it is very, very, very important to not just assume, okay, this is my Parkinson's disease, and blame it everything on the Parkinson's disease. If there is a new symptom, it is really important to also talk to your primary care provider, your gerontologist, or a different specialist, because sometimes people will kind of throw everything in the Parkinson's bag, and then there's actually a, a different medical concerns that has nothing to do with Parkinson's disease, but it's not getting assessed. So it's important that if something new comes up, reach out to your primary care provider, maybe reach out to your neurologist to see if it is part of the diagnoses. Otherwise, you want to make sure that you get that evaluated as well too. For nutrition value, a lot of brain health experts do talk about the Mediterranean diet. So for overall brain health, so vegetables, fruits, different salmons and fishes, olive oil, whole grains, um, beans, lentils, and there's different ways, and that doesn't mean eat Mediterranean for every meal, but it's good to increase ways that we can add this to our life for health and then brain health as a whole. As a whole, we mentioned for our healthcare team, it's not just me that's diagnosed with Parkinson's disease, but it's my entire team that can help me. So who's your movement disorder specialist? So there can be a neurologist, right? And this is something I like to educate people on. You can see a neurologist, a general neurologist, but it may be helpful to actually see a movement disorder specialist. So this is a neurologist who specializes in Parkinson's and movement disorders. That would be like maybe a comparative would be like, okay, I'm going to go to a counselor, but let's say I'm actually really dealing with grief. Maybe it would be best for me to go to a bereavement counselor who somebody specializes in this. So, and that's not to say one is better or worse than the other, but movement disorder specialist, you're working with somebody who really and truly knows Parkinson's disease, and they did extra training, extra specialty in that. So keep them involved and updated. Also, rehab services, so PT, OT, speech therapy. As we mentioned, it is common for individuals to have increased concerns with maybe some mental health. So it's not unusual for people to see a psychiatrist, to see a counselor, to see a social worker, to see a psychologist, to join a support group. And also keep in contact with your primary care physician. If you are experiencing a symptom, don't just assume it's the Parkinson's disease. Different specialists, nursing, and nutritionist. And exercises and wellness is huge, huge, huge. I can't say that enough. It's huge with Parkinson's disease, and it can really, truly impact your quality of life and the progression of the disease. So it's important to try to stay as active as possible for as long as you can. So I'm just going to, we're going to go just for some different resources, but before we do that, let me just share something else really quickly. Okay, so I just wanted to talk a little bit about self-care. We have about 10 minutes and then I'll open it to question and answer. So we can touch on a few things here. So as a social worker, there's different tips and suggestions that I provide as well too. So it's important for people to understand who's their support during this time. So outside of our doctors, right? Family isn't always necessarily determined by DNA. Just because somebody has the same DNA or is a blood relative doesn't always mean that they're maybe family or there to support you. So the psychological family is who do you get to choose and who is a part of your life that can support you. So this could be somebody who is blood related. This could be a sister. This could be a child. This could be a neighbor. This could be a chaplain. This could be a furry friend, a cat, a dog, or um, a little smaller soul. This could also be spiritual as well too. Some people find support in going out into the nature, into the garden. So you get to choose your family and who's supporting you throughout this time. Um, Also having additional contact information for mental health services. And then another thing that I like to touch on is externalizing the trauma. So a lot of people and individuals will, blame themselves, or if they're a caregiver, they'll get mad at their loved one. And yes, it's understanding that, we are the individuals experiencing these symptoms. However, I'm not waking up one day and saying, okay, today I'm going to have the tremors, I'm going to have difficulty with gait, and I'm going to have difficulty communicating. It's the Parkinson's disease that is to blame and not the individual. So a lot of times we can be hard on ourselves, and I know it's a lot easier said than done, but maybe finding some ways that we can work on self-compassion or gratitude as well too. If I'm having a bad day, and we all have bad days, just even telling myself, okay, Nicole, it's the Parkinson's that I'm mad at. It's not myself. It's the Parkinson's that is doing it. Or even with couples and spouses as well too. We lead a caregiver support group, and this helps them to understand, man, I'm not mad at my husband all of the time. I'm mad at the Parkinson's disease, and it's the Parkinson's disease fault and not my loved ones. So finding ways to increase practice of that and ways to increase resilience. So resilience is the ability to persevere and keep going despite adversity. When there is no cure just yet with Parkinson's disease, we find ways to build resilience. So expressing emotions, crying, going to a counselor, journaling, letting those emotions out. And, whether some people feel more comfortable doing them, crying with a friend there, some people like to um, be alone, whatever works for you. And, there are different losses with Parkinson's disease. So sitting with the losses and experiencing them and expressing them, it's not wallowing, but you're actually giving yourself a time to actually cope and to sit with it and to be present with it, which can help in understanding your grief as well too. So educating yourself, Parkinson's disease, even though there's a variety of symptoms, it doesn't mean everybody's going to experience all of them. It doesn't mean everyone's even going to experience two of them. So it might be helpful to kind of educate yourself, but also understand that, this is something that can occur, but it doesn't mean that it will. Um, Also advocate as well. There's different advocacy through the American Parkinson's Disease Association. We have the Optimism Walk or working out, but it's also important to know that doing nothing is resiliency too. We don't always have to be doing something. That can mean coming home, sitting with our dog, watching TV. Resting is resiliency. We need to rest. Self-care for yourself, um, ways to be resilient and strong, being mindful, aware of your own feelings and health, having boundaries, taking time for yourself for rest and self-care. It's okay to say no. It's okay to tell people I can't do that right now. You need to have yourself as your first priority, and what can I do to enhance my own life and to take care of myself. Talking to friends, eating well, getting enough sleep and exercise, and talking to supports each day. Something that I kind of like to do to visualize what I may need at a time. So, let's say typically, one of my teachers told me this, and she said, okay, picture your heart, and there's a string hanging down from your heart, and it's a bucket. And the bucket is all the things in my life that are, maybe occupying my time or occupying my stress, things that are just kind of difficult to deal with right now. So health issues, workload, relationship stress, anxiety, deadlines, diagnoses. Let's say there's all these individuals in my bucket. And man, last night I did not have a good night's sleep. I didn't sleep well at all. I was cranky. Yesterday I couldn't deal with all this, and my bucket was overflowing. So what can I take out? Maybe my friend needs support or somebody to reach out to or something like that. You know, maybe just for today, I'm going to have increased boundaries and take this task out. And it doesn't mean that the task can't be back in, but it's understanding your bucket. When is it to capacity and what can be taken out that doesn't have to be there right now, that can come back in the future, but doesn't need to be there while we're already feeling overwhelmed. So it's kind of a good visualization to use. And then there is a REST acronym. So when we say rest, and when that's even, you know, like spending time with your dog or watching TV, R stands for relax. And relaxing isn't sleeping. Relaxing isn't taking a nap. Relaxing is having time to yourself. So hydrating, resting, reading a book, making a cup of tea, some coffee, having time to relax. E is exercising and eat well. S is sleeping or step outside. So getting at least those 8 hours of sleep, getting some fresh air. It's cooler out now, or talking to somebody. You know, we're not here in this alone, so who can you reach out to? And a final thing is even just having like a gratefulness board. So I've had individuals with a dry erase board, and every day or at the end of the day, they list 3 things that they're grateful for. And this actually helps them to increase quality of life, loving, awareness, and support as a whole. And sometimes even within a week or within 2 weeks, they'll say, hey, you know, I don't only have 3 things that I'm grateful for. Now I'm up to 5 or 6 or 10. So that can really help with mental health and quality of mind as well too. And then if you're ever interested, Insight Timer with like kind of like the meditation gong. This is one of my favorites. It's free. You can use it for 5 minutes. You can use it for 3 hours if you're trying to go to bed. But these are different apps. And then here are some American Parkinson's Disease Association resources. As I shared, I lead a variety of support groups for Parkinson's disease. We have a monthly group. We have education groups where our neurologist presents. We have a caregiver group. We have a newly diagnosed group. We have a variety of things. So support groups, publications, a lot of education on different symptoms that can be sent to webinars, our hotline. And then here are some other links to our publications, tracker app, handbook, exercise guide. All this can be found online. Different webinars. And then, does anybody have any questions? And what I'm going to do is I'm going to put my contact information in the chat so that if you guys have, let me see. Okay, hold on. So the phone number that I'm going to be listing is my American Parkinson's Disease Association phone number. So it is a landline, so please only call, no texts, otherwise I won't get it. But I'll send that right here. And then I'm also going to, okay, that's my phone number. And then let me put down my email if you prefer to email. Okay.
Nicole, while you're typing that, I just wanted to introduce, we have our adult program coordinator, Karen Brownlee, on our chat today. And Karen, just speaking to tie in with the managing our wellness and exercise, Karen wanted to talk about some specific programs we have for exercising, specifically for people with Parkinson's disease at the YMCA. Just briefly, if you don't mind.
Oh, perfect. Yeah.
Hi, everybody. Yes, my name's Karen Brownlee. Thank you, Amy, and thank you, Nicole. I teach a class at the Y called Your Workout, Your Body. The class is a small group personal training class, and almost everyone in the class has Parkinson's disease. We started it out as a Parkinson's only class, but we have some other people in the class who have other bodily challenges, I'll call them. The class is offered on Mondays and Wednesdays at 11:35 a.m. here at the North Suburban YMCA, and I have put my email address in as well if you're interested in the class or you're interested in learning more about what we offer for people with Parkinson's disease. Our Y, we do the voice work in the class, we get our heart rates up, we do flexibility, we do strength training, and we do balance training. So all of those things that Nicole mentioned during the program, we offer in the class as well. So I just wanted to put it out there. If you're interested, please feel free to email me. I'll be happy to give you more details about it. Thank you so much for your time. Thanks for this great program, Nicole, and thank you for offering this program, Amy. It's awesome.
Thank you, Karen. Okay, I'll leave it back up to questions. Sorry.
No, you're good. Yeah, there's different like programs at the YMCA. Even like I think there's one in Naperville, and they offer aqua for Parkinson's. So it's great to have those.
Yeah, I think there's also like pedaling for Parkinson's too, which
Mhm.
is like a cycling class. We don't have it at our YMCA, but I have heard of it before.
Yeah. Does anybody else have any other questions on anything that I mentioned, discuss, education, support? I think everyone's on mute, so feel free to unmute yourselves or write in the chat.
Nicole, I have a quick question.
Mm-hmm.
Are there often like triggers for some of the symptoms such as tremors? Or is it like you said, how sometimes somebody with Parkinson's might wake up and have a hard time with tremors that day, and then maybe not as much the next? Have you found that there are kind of triggers?
So I think there can be different things that impact it. I think, it would probably be best answered by one of the neurologists, but as a whole, like it can definitely be medication. So if somebody does forget to take a dose, like, as a whole, medication's important, right? But I mean, with Parkinson's, it's super, super important to take it on time. So even if somebody did miss a dose, that can impact the tremors and quality of life as well too. Some people, different things can impact it as well too in terms of stress. We have different patients that, maybe experience a high level of stress, and the stress is correlated to the tremors as well too. But, I would make sure that everybody is taking their medication at their time that it is prescribed. And if somebody is noticing increased tremors, maybe talk to your neurologist to see if something does need to be adjusted.
Thank you.
Any other questions? Okay, well, if anybody does have a question or wants to reach out, my contact information is in the chat, and feel free just to send that out as well too. If somebody has maybe a more intimate question, or they want to reach out for different resources, or have me forward them something, I'm happy to do that as well.
Oh, Nicole, thank you. On behalf of the YMCA, we thank you so much for your expertise. I know I learned a lot today. I really appreciate it. And we hope to see you again soon.
Thank you so much for having me. Have a great day. Take care, everyone.
Bye-bye. Thank you.
Bye-bye.